I'm Dr. Brittany here at Hebron Animal Hospital, and today we've got Gigi. We're going to go over preventative care stuff like vaccines and just wellness stuff, as well as heartworm prevention, flea and tick prevention, things that are required to keep your pet healthy. My assistant Amanda is going to help by asking some questions.
All right, Dr. Buter, what information does my veterinarian need to know about my dog's lifestyle before providing preventative care recommendations?
There are a few lifestyle specific vaccines. Your typical core vaccines are going to be your distemper parvo, which is typically one vaccine together, as well as your rabies vaccines. Then there are kind of what we consider social vaccines, which is your bordetella and your influenza. Those are kind of respiratory related vaccines. And then your wildlife or wilderness guys. So hunters, hikers, people that have a lot of land or property. That's your Lyme and your lepto. Lepto is a disease that is spread by deer urine, and then Lyme is spread by ticks. So knowing what your activities are for yourself, your pets, that kind of helps lead us into different things we can do to keep your pets healthy. But some pets that are just couch potatoes and don't do anything don't necessarily need all the extra vaccines.
Okay. How can I keep my dog safe while in the car?
They do make safety harnesses and seat belts, as well as some dogs do better like in crates and things like that, but you want to make sure that those are tied down or bungeed. A lot of the car insurance companies have some good products as far as helping figure out what's best for your size pet in the car. But definitely just the distracted driving component of it, keeping them out of your lap in the front seat, things like that are very important.
Okay. What can I do to keep my house and yard pets safe?
Pretty much just making sure anything is kind of like child proofing. So we don't want a bunch of cords. If you do have a dog that chews on things, you want to make sure that those cords are kept up. Having a good fence intact, whether it be an electric fence or an actual physical fence, especially if you live in a neighborhood where you have roaming dogs or dogs that you don't really know the history of. You can do different things as far as if you get your yard treated or sprayed, fertilized, keeping your pets off of that for a good day or two, even if they say their pet's safe. As far as inside the house goes, if you have a dog that has separation anxiety or noise triggered anxiety, or any health conditions as far as like arthritis and things, keeping baby gates up so they can't fall down the stairs. If they get nervous, making sure that the windows are closed so they can't jump out the window, things like that.
Okay. What recommendations will my veterinarian make when it comes to my dog's preventative care?
So going over those vaccines again, just for their lifestyle. As far as preventions go, typically even if you have a pet that is inside for the most part only, except just to go potty, we usually recommend heartworm prevention year round just because heartworms are spread by mosquitoes and those can come in the house. The just general wellness exam tells you a lot about what's going on with a pet in their day-to-day lives as far as detecting heart murmurs, checking their weight, new lumps and bumps. Dental health is huge for pets, and we don't think about that because oftentimes they continue to eat just fine even if they've got a bum tooth. So just kind of routine veterinary checks really gives us a good basis of what's going on every day with them. Also, older pets, checking blood work frequently, maybe every 6 to 12 months, depending on if they're on chronic medications or not. That can always help to find things sooner rather than later, because everything that you get ahead of sooner is definitely more beneficial than letting it go and not knowing until it gets bad.
Okay. Why should I keep my dog on a leash while in public, and which type do you recommend?
Leashing is important, even if you have a very well-mannered dog, mostly because you don't know what other dogs are doing or other people. So also with vehicles and everything like that, we don't want them running after a squirrel or another dog and running out in front of a car. Also keeps them safe from if they get into, even if your dog's nice, some other dog, if you walk by, you don't know if the other dog is nice or likes other pets. So that's definitely important. We don't really recommend the retractable leashes. They can cause some neck damage, but they can also wind you up and cause lacerations and burns on you. So harnesses, the gentle leaders work really, really well for dogs that pull. And then it just kind of depends on the mannerisms of your dogs as far as like the prong collars and things like that. If you go through training to know how to use them appropriately, they are effective for some dogs.
Okay. What illnesses can be avoided by good preventative care?
A lot of illnesses. So distemper, parvo, our influenzas, our rabies, which we do have. A lot of people think that's kind of a bygone disease, but it is still here. All of those, lepto, Lyme, all those diseases can be very easily prevented. And then there are some like kennel cough that you think about. We have a kennel cough vaccine. It's kind of like the human flu vaccine where it typically just decreases the severity of the disease process. So it's a multiple strain disease and it has a component of viral and bacterial. So vaccines aren't going to fully prevent it, but if your pet is exposed, it greatly decreases how sick they get. So a majority of dogs, if they go to the grooming or boarding facility and they happen to get kennel cough, if they are vaccinated, most of the time they can get over that kennel cough by themselves without needing any medication. But if they aren't vaccinated, some of those dogs can get really sick and require hospitalization.
Are vaccinations required by law?
The rabies vaccine is the only vaccination that's required by law, and that is just because it's what's called a communicable disease. So if a pet happens to get bit by a bat or a raccoon that had rabies and then bit the owner, it could infect the owner. So that's why it is only required.
Okay, thank you, Dr. Buter. And as always, if you have any questions regarding dog vaccines or wellness, please give us a call. We're always here to help you.
Thank you.